everyone for coming to tonight's show. This is Julia Anderson with Real Talk. For Black History Month, we are going to give little-known historical facts about, well, Black history. Sitting in our chair tonight is Dr. Brianna Jackson. Welcome to our show, Dr. Jackson.
Thank you for having me here.
Tell us a little about yourself.
I have a PhD in African Studies with an emphasis on world history.
And who are you going to talk about today?
I'm going to present to you Dr. Daniel Hale Williams.
Please continue.
Dr. Hale was born on January 18, 1858 to Daniel and Sarah Williams. At 9 years old, Daniel Sr. died of tuberculosis. His mother was unable to handle raising 7 children alone, and sent some of them to live with relatives. Daniel was sent to live with relatives in Baltimore. There he was apprenticed to a shoemaker. But he soon ran away back to his mother. While living in Janesville, he encountered a doctor, Dr. Henry Palmer, who allowed Daniel to apprentice with him. That lasted 2 years. In 1880, Williams entered what is now called Northwestern University Medical School. After graduation in 1883, he opened his own office in Chicago, Illinois.
If I do my math correctly, he became a doctor at the age of 25.
That is correct. Because of racism and other factors, most black people weren't allowed to go into hospitals. So Dr. Williams often made house calls and performed surgeries on kitchen tables. Seeing the silliness of this situation, Dr. Williams founded his own hospital called Provident Hospital and Training School Association in 1891. A 3-story building that had 12 beds and served the whole community. The hospital also taught nurses and trained doctors of all races. Dr. Williams' medical procedures were well known for being antiseptic, clean, and sterilized. Patients who came into Provident Hospital recovered completely or saw an improvement in their condition. The biggest problem with medical procedures during that time was infection. But because Dr. Williams' insistence on sanitary conditions, his patients fared better than those treated at other hospitals.
That is impressive. Because even today, many people who have surgeries have to worry about infections.
Exactly. But the best is still to come. On July 9, 1893, James Cornish was stabbed in the heart in a bar fight. Arriving at Provident Hospital near death, Dr. Williams performed open-heart surgery on Cornish. Dr. Williams repaired the pericardium, which is the sac around the heart. Amazingly, 51 days later, James Cornish walked out of Provident Hospital.
This was before in the 1900s? Did the man live?
Not only did James Cornish live, he lived for another 50 years. In 1894, Dr. Williams was appointed as chief surgeon at the Freedmen's Hospital in Washington, D.C. He reorganized the hospital, setting up different medical and surgical departments. Doctors traveled from all over the country to learn and view the multiracial medical staff do their jobs. Because of his medical procedures and professionalism, patient deaths decreased all over the country.
Wow, that really is impressive. Thank you, Dr. Jackson, for this informative presentation.
Thank you for allowing me to be here.
I want to thank you all for being here today. This is Julia Anderson with Real Talk. Bye-bye.